Here's my audience for my speech on NRP. Got everybody? Got everybody? Okay. All right. Okay. Good evening. My name is Annette Nixon, and I'm here to inform you about the steps of neonatal resuscitation. While working on the labor and delivery floor, as well as the neonatal intensive care unit, NRP is a vital tool in saving infant lives. First, I'm going to go over a few risks associated with the need to use NRP by the American Heart Association. Extreme prematurity, low birth weight, and just a transition to spontaneous breathing. Some of the issues that they gave us when I was reading over the book and everything. NRP steps are broken down into 4 blocks that help to ensure NRP steps are performed correctly by the American Academy of Pediatrics. Block A is airway, which is one of the most important steps. In this step, you're making sure infant is placed into a warm environment and that the head is positioned to open the airway. While you're also doing this, you're making sure that the infant is dry, being warmed, and stimulated at the same time. Also looking for breath sounds. Block B is breathing. If baby is not responsive, apneic, which is not breathing, or has no heart rate or a heart rate below 100, you need to assist with positive pressure ventilation and stimulation. Block C is circulation. In this block, if the baby is not responding with heart rate of less than 60, you need to support circulation by starting chest compressions. There are 2 techniques for infants being used for these chest compressions. They are the thumb technique, where you place the 2 thumbs and depress the sternum while your hands encircle the torso and fingers support the spine. The other technique is called the finger technique, where you use the tips of your middle index or ring finger are used to compress the sternum while the other hand supports the back. This enables you to have full support of the baby and control of the situation while you're doing compressions. So you're going to do 1 cycle of compression or events, and that consists of 3 compressions and plus 1 ventilation. You do that for 1 minute, which totals 90 compressions and 30 breaths. The rhythm used for chest compressions with ventilations is 1 and 2 and 3 and breathe, 1 and 2 and 3 and breathe. And you're going to do this for a total of 5 events, and it equals up to like 10 seconds when you do it for 5 events. Last but not least is block D. This is when you need to administer drug. That means the infant is very not responsive, not breathing on its own, or still chest rise and fall is not happening. During this time, the heart rate is still below 60 beats per minute, and it's no sign of spontaneous breathing. This means that a higher level of skill is needed to improve the response. So more than likely epinephrine or some other drugs will be brought into room or used on the infant. Even though these steps may seem easy during a real life crisis, your adrenaline's pumping and even the easy things become hard to focus on. When in a situation when NRP or neonatal resuscitation is needed, your evaluation of respirations, heart rate, and color play a big role in determining whether you should proceed to the next step. You're always evaluating, making decisions, and making some kind of action. Okay. So during these situations when you're in a crisis and you're going back and forth whether to do chest compressions or use the 1 or the 2 or the thumb step, it's okay to practice before you actually get into these situations, because when you get into these situations, it's straight life or death situations, and you need to know what you're doing. So So now that you know the appropriate steps to NRP, you can feel better handling a situation that requires you to use your knowledge and skills for using NRP from block A to B to C to D. And this concludes my video on NRP, how to use it, when to use it, and the appropriate steps to take. All right, thank you.